So I wanted to introduce Dr. Mary to you all. She is a colleague and good friend of mine who is quite skilled in both naturopathic medicine, but also traditional Chinese medicine. She's presenting a bonus doc talk this week on the introduction to traditional Chinese medicine. So you can get a nice background on sort of what informs her clinical practice. Dr. Mary is both licensed in acupuncture as well as she has a master's in traditional Chinese medicine, which includes that acupuncture and Chinese herb component. In addition to being an excellent naturopathic physician here at Prosper Natural Health. So it's my pleasure to introduce to you Dr. Mary Schroeder and her doc talk today.
Thank you, Dr. Rosalie. All right, so let's get started here. Thank you all for being here. I'm really excited to dig into my clinical specialty, which is traditional Chinese medicine. All right. So at Prosper Natural Health, I work with an amazing team of clinicians. We have on the left, Dr. Molly Force. She's a naturopathic doctor and the clinical director. We have Dr. Rosalie Delambert, who is with us today. And she is a naturopathic doctor and also has a master's in Ayurvedic medicine, which is the medicine of ancient India. And in case you haven't seen her outstanding doc talk on Ayurvedic medicine, I highly suggest you check it out. You can find the recording on our website. And again, my name is Dr. Mary Schroeder, and I'll be really digging into my clinical subspecialty, which is traditional Chinese medicine. Okay, so throughout this talk, I'm going to introduce some fundamental concepts in traditional Chinese medicine. I'm going to talk about how we diagnose within the Chinese medical system, and also introduce some of our major treatment modalities. So that includes acupuncture and Chinese bodywork, as well as Chinese herbal therapy and food therapy. All right, so a bit about what is traditional Chinese medicine from ancient times to today. So traditional Chinese medicine is a complex system of thought and practice that's over 2,000 years old, and it's based on extensive clinical observation and testing that practitioners have honed over the centuries. It's both ancient and modern, so while these concepts were developed thousands of years ago, they've been continuing to evolve throughout the centuries. And one of the most amazing things about this medical system is how well preserved it's been to the modern era. To the extent where if you're in China, you may find in a hospital a whole wing devoted to acupuncture and a whole wing devoted to Chinese herbal medicine. So in this way, this traditional Chinese system is used alongside the Western modern biomedical system in China and across the world. And it provides for a really interesting melding of ideas, and it really expands your toolkit and what you can use with patients. As I go through this doc talk, I encourage you to think of all of these fundamental concepts and ideas that I'm introducing as existing within a metaphorical system that was created to describe the way that the body works and the way that disease affects people before we had these concepts of bacteria and viruses were kind of the mechanistic understanding that we have in Western biomedical medicine. So in that way, these two medicines can be used alongside each other. And traditional Chinese medicine offers a different lens and a different inroad into treating patients. So in order to bring these kind of strange concepts that may sound like a completely different language and esoteric at times into a more practical, how do we think about this in terms of how it works within humans? I'm going to introduce 4 case studies. So I'm going to ask you to imagine that 4 different people all have diarrhea, and they all go to their primary care doctor to discuss this diarrhea, and they all get a diagnosis of irritable bowel syndrome. And then in addition, they go to a traditional Chinese medicine doctor, and in the process of getting assessed and treated, each one of them have a completely different syndrome within the traditional Chinese medicine system, and a completely different diagnosis and treatment plan. So in showing you these case studies, it's going to allow us to anchor some of these concepts in a real life example, and also allow you to understand how the diagnosis differs from Western medicine and how we can use it to deepen our understanding of these syndromes like irritable bowel syndrome, where Western medicine frankly doesn't have a very well understood mechanistic understanding, and is kind of lacking in terms of treatments that can help people in significant ways. All right, so let's start off with talking through our first case study. So here we have Zoe is a 25-year-old woman with long-term diarrhea, and she is fatigued throughout the day, has abdominal pain and bloating, and she's worrying constantly. Her diagnosis is spleen qi deficiency. So as I say these diagnoses, you probably will have no idea what I'm talking about, and that's okay. As we go through the doc talk, my goal is for you to better understand these diagnoses and have a sense of what I mean when I say spleen qi deficiency. Our next case study we have here is Sheila. She's a 45-year-old woman with both diarrhea and constipation. And while she also has abdominal pain and gas and bloating, she's also extremely irritable, easily frustrated and angry. She also has insomnia and tension in her neck and shoulders. And her diagnosis is going to be liver qi stagnation invading the spleen. Next, we have a 30-year-old male with diarrhea. He has yellow, foul-smelling stools. He struggles to lose weight, and he also loves to eat cheeseburgers and milkshakes. So Carl's diagnosis is damp heat in the large intestine. And then lastly, we have Judith. She's a 70-year-old woman with diarrhea, and she also has abdominal pain, but in contrast to the other people, she has a cold sensation in her abdomen, extreme fatigue, and soreness in her low back and knees, and osteoporosis. And her diagnosis is kidney yang deficiency. All right, so now we're going to go through some fundamentals within traditional Chinese medicine. And as we go through these fundamentals, I'd love for you to think about those 4 different case studies and the qualities that exist within their symptoms and symptom pictures, and see how they may apply to these fundamental concepts. All right, so our first major concept is that of yin and yang. You may be familiar with this from popular culture. We kind of use these terms colloquially in a lot of our culture. In the original term for yin in China was the shady side of a mountain. That was what its original character meant. So you can see on the right-hand side here, we have the shady and the sunny side of a mountain. And that's the way I like to think about yin and yang. So yin represents this kind of nourishing, cold, feminine, interior, darkness, tranquility, quiescence, versus yang is our heating, stimulating piece that is all about movement and excitement and vigor and light and being external. So these are two metaphorical, dualistic, opposing ideas that in Chinese theory exist within everything. And our goal with our traditional Chinese medicine is to bring them into balance. So when either yin or yang are too low or too high, we want to bring them back into equilibrium with one another. Our next fundamental concept is qi. So qi in the ancient Chinese theory is more broadly the thread that connects all beings. And in a clinical traditional Chinese medicine sense, we think of it as the dynamic of engendering movement, tension, and activation. So you can think of it as the gas in a car or the wind in a sail. It's what's allowing us to transform energy into action, into movement. And in Chinese medicine, another important thing it does is protects the body from what we call external influences or disease. Our next concept here is that of blood or shui. And in its most basic form, it's the red substance that circulates in blood vessels and nourishes and moistens tissues and organs. So that is very similar to our concept of blood in the Western medical sense. But how the concept of blood in the traditional Chinese medical system differs is that it's the material foundation of all mental activities. So we really need blood to be able to focus, to feel centered, to be able to sleep. And we'll talk about how blood plays into the organ systems as we go further in this doc talk. All right, so next is our concept of the 5 elements. If you heard the doc talk in Ayurvedic medicine, Ayurveda also has 5 major elements. And though they're slightly different from this Chinese medical system, so each of these elements are, again, a metaphor to explain the way that the body works, to explain the way that people's personality work and the way that the seasons function. So they're all defined by qualities. And so, and they all create each other and control each other. So like the yin and yang concept, the goal within Chinese medicine is to bring all of these qualities into balance. And when either wood or fire or earth or metal or water become out of balance, either have too much or not enough of one of them, that's when disease arises. So within these 5 elements, we'll look at wood. So the quality of wood is to grow and flourish. You can kind of think of like a seed sprouting. The quality of fire is to be hot and flare up. The quality of earth is to create and nourish. The quality of metal is to descend and be clear. And the quality of water is to be clear and flow downwards. And again, the job of all of these is to balance one another. So for instance, water and fire are often kind of in a dynamic equilibrium with one another. And water is really good at controlling fire. So when fire is too strong, we bring in the water element to calm it down. Okay, so next I'm gonna describe the Chinese organ system. And we're going to really focus on the yin organs as they're the major players in how, when we're talking about how our understanding of how the body works. Each organ is associated with one of the elements I just described. And here we're going to really dive into these yin organs. So we have the liver or gan, the heart or shin, the spleen or pi, the lung or fei, and then kidney, which is also known as the shen. So as we talk through these organs, I might sound like a broken record, but again, remember that they're not literal. So they're not the organs that you can cut out and hold in your hand. They're these metaphors that exist within a system that describes how physiology functions. And they are all translations that were, they took words like gan from the ancient texts and found the closest analogy within the Western biomedical systems. We call it the liver. And they often have similar functions to the Western Chinese organ. But the major difference within the Chinese medical system is each of these have both physiological functions and a psychological component, which is very different than the way we understand our Western organs to work. Okay, so here I'm going to dive into the concept of the spleen. So the spleen or P is associated with the earth element, and its functions are to transform food into qi and blood. So remember, the earth element is all about creation and birthing. And so it's responsible for transforming the material substance into energy, into what we use in our body. It's responsible for digestion, and it's also associated with planning and worry in the more mental and emotional realm. So when the spleen is in balance, you will have abundant qi and blood, because that spleen is using food to create qi and blood. And we'll also have healthy digestion. People will feel enthusiastic and able to make decisions. And when the spleen is out of balance, someone might have loose stools, abdominal pain and bloating, really be unable to absorb their nutrients, and they'll have ruminating thoughts. So they are constantly chewing on ideas and unable to fully digest them and kind of move forward with a decision. Next, we'll talk about the liver. So the liver or gan is associated with the wood element, and its functions are to maintain the free flow of qi, and it also softens and tempers the qi. So I like to think of the liver as the conductor in an orchestra, and the conductor is allowing the organs to play harmoniously together. It also lubricates ligaments and tendons and has a big influential role on musculoskeletal pain in that way. It has a major role in emotional activity, and it also is responsible for our sense of self and direction in life. So when the liver is imbalanced, we'll experience a relatively relaxed internal environment. Someone may have an even disposition, and they'll also be both physically and mentally flexible. Versus when it's out of balance, someone will be really easily irritable and angry, kind of inflexible, having tight tendons and ligaments, and also just mentally inflexible. They'll also tend to have more body pain, and spasms and tightness. Okay, so moving on, the next organ is the kidneys, or shen. And the kidneys are associated with the water element, and their functions are to promote water movement and water metabolism, and also to promote bone health. They also play a big role in our sort of stages of growth and development. So big role in birth, growth, maturity, fertility, and aging. So when the kidneys are out of balance, you may see someone having early aging, infertility, water retention, issues with urination, and low back pain, kind of all kinds of musculoskeletal issues, joint pain, and weak and brittle bones or osteoporosis. All right, next we have the heart organ, also known as shin. And this is associated with the fire element. Its functions are to control blood and blood vessels. That's very similar to our concept within Western medicine. And in Chinese medicine, one of its main roles is to house the shen. This is also known as the spirit. And it plays a role in our sense of presence, thought, reflection, self-awareness, short-term memory, and communication. So when the heart is in balance, we're more able to choose our words precisely and express warmth to others. And when the heart is out of balance, you'll often see people have heart palpitations, chest pain, anxiety, forgetfulness, and just having difficulty communicating their needs and emotions to other people. All right, our last organ of the 5 major organs that we're going to discuss here is the lung organ, or Fei. So the lungs' job is to control respiration, so inhalation and exhalation, and generate qi from inhalation. So you can kind of think of that as oxygenation. It is associated with the emotions longing and grief. And the lung also rules the exterior. So something we'll get into in a little bit here is the concept of the exterior influences invading the body, forming disease. And the lung is the first thing that suffers when that happens. And you can think of, the common cold and often kind of upper respiratory congestion as being the first stage of a lot of conditions. That's the idea there. So when the lung is out of balance, often when we see there's not enough qi in the lungs, we'll see shortness of breath and asthma. And also people will tend to be melancholic, tend to have a hard time moving through grief, and they can more easily catch colds. Okay, so next we'll go into those causes of disease I was just describing. So again, I want you to remember that these concepts were being created before we had concepts of viruses and bacteria. And so when they were kind of considering what's causing these diseases and what causes people to feel pain and get sinus congestion, it started with this idea of wind invading the body. And wind invasions carry different kind of temperatures and textures with them. So you can have a wind cold invasion, a wind heat invasion, and wind damp or wind dryness. And all of those lead to really different versions of the common cold with different symptoms. And all of these factors, cold, heat, wind, dampness, can play a role in other parts of the body as well. We also have this idea of strong emotions causing dysfunction and imbalances that can predispose us to disease. So those can be grief, anger, worry, and fear as some of the major ones. And then lastly, for our fundamental concepts, we have this really important one of excess versus deficiency. And again, this speaks to the goal in Chinese medicine to bring things back into balance. So you want everything to be even keeled and at its right proportions. So if we don't have enough qi, we call that qi deficiency, and we want to tonify qi. Similarly with blood, if we don't have enough blood, we'll often see symptoms sort of similar to the Western concept of anemia, so a lot of fatigue and difficulty concentrating. So in Chinese medicine, we would say we want to tonify blood in those cases. Versus with heat and cold, we may have excess heat or cold, causing digestive issues, causing many different things. And in that case, we want to clear that excess to relieve that imbalance. Okay, so next we're going to go into how we diagnose and treat in the Chinese medical system. And we'll start with examples of how we take history and symptoms from our case studies to identify which organs and which kind of qualities are out of balance. And then we'll go into our TCM specific diagnostics, so that's tongue and pulse diagnosis. And here I'm going to bring the case studies back in so that you can kind of tie in those fundamental concepts to these, fake, but call them real live people. So here we have our 25-year-old woman, Zoe, with long-term diarrhea. And when I look at her history, I see that she is having that abdominal pain and bloating with the diarrhea, and she's constantly worrying. That clues me into a dysfunction with the spleen organ. And the fact that she's fatigued throughout the day tells me that there's some sort of qi deficiency happening here. So taken all together, this diagnosis fits best with a syndrome we call spleen qi deficiency. So in contrast, our patient Sheila she's not that tired, but she is extremely irritable and frustrated and angry and having insomnia and tension in her neck and shoulders. So she also has abdominal pain, gas and bloating and diarrhea, but the rest of her symptoms are really different. So all of that irritability and insomnia and tension in her body tells me that there's a liver qi stagnation involved. And in contrast to Zoe, who has a deficient condition, Sheila has an excess or stagnant picture. So here, she also has a spleen component, because remember, spleen is related to the digestive system, and she's got these digestive issues going on, but the liver is the main organ that's out of balance, and the liver qi stagnation is invading the spleen. This speaks to an important relationship between the liver and spleen organs. So the liver, as I said before, it acts, when it's in balance, it acts as the conductor to make the organs function harmoniously together. But when it's out of balance, you can think of it as the bully, and it's sending qi kind of erratically to different organs and causes them to malfunction. So here we see liver qi stagnation kind of bullying the spleen and causing it to not function in its optimal way. Okay, so next we'll look at Judith. This is our 70-year-old woman with diarrhea. And in addition to abdominal pain, she also has a cold sensation in her abdomen. So when we see cold, we think, is this excess cold or deficiency cold? Um, our going back to the concept of yang, remember that's our warming, activating piece of the yin and yang. And when yang is too low, that can make someone feel cold because you don't have yang there to warm you up. And that, along with her extreme fatigue, tells me that she's in a deficiency place. And then in addition to that, she has the soreness in her low back and knees and osteoporosis. That again tells me that the kidney is involved, because remember, the kidney is really highly related to the musculoskeletal system and our bone health. So that leads us to her diagnosis, which is kidney yang deficiency. And then lastly here we have Carl. He's our 30-year-old male with diarrhea. He has the yellow foul-smelling stools. He struggles to lose weight, and he also loves cheeseburgers and milkshakes. So the yellow foul-smelling stools tell me that there's a heat component going on. That's the way we look at those qualities of the stool. And there's also the difficulty losing weight, and weight gain is a sign of dampness. And cheeseburgers and milkshakes, that kind of heavy dairy, heavy food, is a major cause of dampness in the Chinese medical system. So all of this together tells us that he has an excess condition versus a deficient condition, and he has damp heat in his large intestine. Okay, so next we're going to go into tongue diagnosis. If you've ever been to an acupuncturist and they ask you to stick your tongue out, that might seem very strange, but it's all based in this concept that the tongue as a muscle is a reflection of the internal environment of the person, of each of us. And so when we're looking at the tongue, we're looking at a bunch of different qualities. So we're looking at the color and shape of the tongue base. And we're also looking at its texture. And then in addition, we're looking at the tongue coating and whether it's thick or thin, and the color of the tongue coating as well. So here's an example coming back to Carl, our 30-year-old male. Looking at his tongue on the upper right-hand side here, we see that there's some significant redness on the, in his tongue body that's telling us that there's some heat going on. And then we also see this thick coating with yellow in it. So the thick coating is a sign of dampness, and the yellow is another sign of heat. So this is another confirmation that what we're dealing with here is a damp heat picture. Okay, next we can talk about pulse diagnosis. So similar to tongue diagnosis, in pulse diagnosis, we're also looking at these qualities versus, we're not looking at numbers like we would in a Western medical perspective. So we always feel the pulse on the thumb side of the wrist. And what we're looking for here is its strength, its quality and shape. So there's many different ways to describe a pulse in Chinese medicine. Sometimes you can describe it as a wire hitting your fingers. That's kind of indicating tension. You can also describe it as a bean being dragged through the vessel. And some of them you can describe as flooding, some you can describe as an ocean wave. And all of these give us clues into different diagnosis within Chinese medicine. Lastly, we look at the position. So each of the positions you see here, 1, 2, and 3, correspond to a different organ. So it allows us to decide which organs are out of balance based on the strength and weaknesses of each of those. So going back to our case study, our patient Sheila here is, again, she is really irritable and frustrated. She has a lot of tension in her life and in her body. And her pulse is what we call wiry. So a wiry pulse feels like you're taking a wire and pulling it taut over and over again. And that is another indication that there's a stagnation going on in the body, and it points us to the liver being involved in whatever is happening in our concept of, as we're building our diagnosis. So in contrast, we have Zoe, who has a really thin and weak pulse. So when we see that, that is a big sign that there's a deficiency going on, and it kind of confirms our hypothesis that she doesn't have enough qi and blood in her system to fuel her daily activities. Okay, so bringing this all back together, we've seen 4 different syndromes that all correspond to a chief complaint of diarrhea. So Zoe had spleen qi deficiency, Sheila had liver qi stagnation invading the spleen, Carl had damp heat in his large intestine, and Judith had kidney yang deficiency. So again, this is our way of looking at one Western medical chief complaint and diagnosis, and digging deeper into someone's kind of qualitative signs and symptoms to give us a kind of more well-rounded understanding of what is happening in their body and how we can treat them. So as we go into our treatments now, we can see how each of these will prompt a very different set of acupuncture points, a different set of dietary and lifestyle recommendations, and different herbs that we'll use to treat each patient. Okay, I'm just going to take a sip of water here. All right, so next we're going to talk through within treatment in the Chinese medical system. I'll talk through our goals of treatment, as well as acupuncture and Chinese bodywork, and then we'll go into Chinese herbal medicine and food therapy. So our goals within traditional Chinese medicine treatment is to balance yin and yang and to balance the 5 elements. This often involves tonifying anything that's deficient and clearing excess. And another goal is to maintain the free flow of blood and qi. This often helps us relieve pain and make sure that the organs are functioning well together and that it's all functioning like a well lubricated system. So here, let's talk about the Meridian System in Chinese medicine. So this Meridian System is the basis for acupuncture and Chinese bodywork. And as you can see on the right, there's hundreds and hundreds of points that are arranged throughout the body. And they've been arranged into these meridians over time based on pain and tension patterns that practitioners have identified. So each meridian is associated with an organ. So we talked about those major 5 organs before: the lung, the heart, the spleen, kidneys. And all of those have their own meridian at a different point in the body. There's also a paired yang organ. So each of the yin organs has a yang organ that's associated with it. And there's another set of meridians on the back of the body that are the yang meridians. And they're all associated with the yang organ. So another thing to keep in mind is each point has a specific indication. So all of these individual points along these meridians will affect the organ and the meridian in different ways. Some are more heating and activating, and some are more cooling. And so, for instance, if I were to take a point up in my hand to affect the large intestine channel, be really different if I used one up in my shoulder. So let's go into acupuncture and Chinese bodywork. So with acupuncture, we're applying needles at specific points to move qi and blood, to affect the internal organ that is associated with that meridian, and often to relieve pain. There are many theories within Western medicine as to how acupuncture works, and we don't understand it to a full extent at this point. But there are studies that have shown that when you stimulate certain points, there is a release of natural opioids and endorphins that we produce in our bodies. So that is one of the theories as to why acupuncture is so effective for pain management. And we also know that a lot of these acupuncture points are located in areas where we have a greater access to nerves and where there are fascial bundles. So fascia are these collagen networks that exist throughout the body and play a really large role in our tension patterns. And these acupuncture points often exist kind of between muscle groups and in these areas where there's space between the fascia. So you have kind of a stronger sensation and it'll be closer. You'll kind of get deeper more easily and closer to a nerve than, say, a point 1 centimeter away. So why would you come in for acupuncture? The reasons that I see the majority of patients in my practice are for body pain, so often low back pain and neck tension. It's also highly indicated for any nervous system disorders, so MS, Parkinson's, often peripheral neuropathies or numbness and tingling in your hands and feet. Really great for muscle spasms and any consequences of stroke, so muscle weakness, deficits in your sensory organs. And then we also have often people are coming in for digestive disorders and also help with menopausal hot flashes. And so many more things, from fertility to anemia. You can really treat most things that people come into the doctor for with acupuncture. So next, let's go into an example of how we would use acupuncture with one of these patients. So we'll talk about Sheila again, and remember she has this very tense, stagnant picture, and her diagnosis is liver qi stagnation invading the spleen. So in our treatment plan, we want to simultaneously clear liver qi stagnation and tonify the spleen. So in our acupuncture point selection for her, we're going to start with the 4 gates. These are a set of 4 points that strongly move qi in the body. So LI4 exists in the webbing between our thumb and index finger. And if you press it on yourself, you'll likely feel a pretty strong sensation. This is a great point to press if you're ever in acute pain, or especially if you have a headache. it's just going to kind of alleviate some of that pain and, as we say, move chi in your body. The other major point we're going to use here is liver 3. That's the kind of mirror point, and that's between that's in the webbing between the big toe and the second toe. And together, these are, again, all going to strongly move chi and soothe the liver. Another point we may choose is spleen 3 that exists at the base of the big toe mound. It's also very tender in many people. And this one is great for tonifying the spleen, so improving our spleen digestive function. So also with Sheila, remember she has that neck and back pain. And so I would likely use cupping on her to help relieve some of this tension. So next I'm going to go into cupping and how cupping works. So on the right-hand side, you'll see I'm holding a cup and a flaming cotton ball. And what I do in this practice is I heat up the cup with the flame to create a vacuum and then place it on someone's back. And I'll often do 6 or 8 cups up along someone's spine on either side. And this can really feel, people will describe it as a backwards massage or, pleasantly being attacked by an octopus. It's a great way to release fascia between the muscles and stimulate blood flow. So when you have this long-term tension where you're really tightening a muscle and you need to kind of bring blood flow and release some of that fascia and tension, this is a great modality for that. On almost all of my patients, I also like to use acupuncture and Chinese body work. I like to use acupressure and massage in addition to acupuncture and cupping. And acupressure is a form of massage where we're really keeping the meridian system in mind. So as we're doing acupuncture, we can think about how we may be affecting the organs. And, if you have a pain in your shoulder, I'll probably massage up near your scapula and down near your elbow, because that all exists in a channel we call the small intestine channel. And that kind of helps inform the way that the fascia and the meridians kind of affect body pain in these longer stretches of the body versus just one spot where you're actually feeling the pain. All right, next we're going to go into Chinese herbal medicine. This is a vast and complex herbal tradition that I'm going to summarize in about 5 minutes. But it is one of my favorite things within Chinese medicine. We have over 400 herbs within the Chinese herbal formulary that we combine in different amounts for specific conditions and with each patient. All of these herbs are categorized by their taste. So, this can be sweet, bitter, pungent, etc. And those correspond to their properties. So for instance, bitter is considered cooling and kind of drying dampness, versus pungent is considered heating. And these all have different effects on the body. So there are many classical formulas that have been developed over the centuries by practitioners, and they tend to contain anywhere from 2 to 25 to 30 herbs. And over time, these practitioners have been honing them based on the herb's ability to kind of act synergistically and be effective for specific syndromes, as we described with the spleen qi deficiency, kidney yang deficiency, etc. So when you are getting these raw herbal formulas, you'll often need to go to an apothecary. These exist in China and all over the world. We actually have one in Port Townsend at Nourishing Life. And I really love the Chinese herbal medicine dispensary at Bastille because they have a really great selection. So you might find a wall of herbs as we're showing in the picture to the right. And the person putting the formulas together will take a prescription from a Chinese herbalist like myself and gather the herbs and mix them in different amounts. And then you take them and boil them at home and drink that throughout the day. And that's your medicine that's highly individualized for your picture. In addition to these kind of raw forms where you see these roots and seeds and berries, we also have forms that are a little bit more efficient. So we have powdered forms where they've all been cooked and put into a powder, and so you just mix it in water. And then we also have tea pills for people who are on the go a lot. So let's go back again to Sheila and see how we can help her with Chinese herbal medicine. So for her specific picture, which is liver qi stagnation invading the spleen, again, we want to clear her liver qi stagnation and soothe her liver while tonifying and helping out the spleen. And so for her, we're going to do Xiao Yao San, which is a famous herbal formula. Next slide. So Xiao Yao San is translated to free and easy wanderer. It's so the idea behind this is, you know, rather than in contrast to that kind of stressed out, irritable picture where you're just feeling inflexible and easily angered, this formula helps you navigate the world freely and easily. Its job is to soothe the liver, spread liver qi, and tonify the spleen. And this formula is widely used across the world for anxiety, digestive issues, and irregular menses. Again, always within that syndrome of liver qi stagnation. So here are the herbs to the right. This is from when I made Xiao Yao San a couple of months ago. And on down here to the left, you'll see all of the herbs and what they do. And you can look through this if you're interested, but the main point here is to understand that each herb pair is acting on the body in a different way. So we're soothing the liver, tonifying the spleen, tonifying blood, and harmonizing the formula. And this kind of gives you a sense of the complexity of these formulas and, you know, how they all work together to treat this kind of complex syndrome. Okay, so our last thing we're going to talk about is food therapy. And what I love about food therapy is this is our daily medicine. This is the way that you support yourself from a foundational standpoint. And in Ayurvedic medicine and traditional Chinese medicine, the amazing thing about these particular ways of looking at the body and using food within that system is that it can be highly individualized. So whereas in Western medicine, generally, you know, we know that it's great to eat fiber and eat a wide variety of colorful vegetables and fruits for your health. In this system, we can take any given diagnosis, so you know, whether it's a heat diagnosis or a cold diagnosis, and use specific food tastes and properties to address that syndrome. So for instance, we would want to use warming foods for excess cold or yang deficiency. We want to use cooling foods for excess heat or yin deficiency. And we can also use food to tonify blood and qi. So for blood deficiency, for example, you know, this is similar to the Western concept of anemia. We may want to increase someone's intake of bone broth and beef. You know, you can also start eating more beets and really dark colored fruits and vegetables. So that's an example of how we would use that. All right, so to bring this home, let's go back to Judith, our 70-year-old woman with diarrhea. And again, remember she has that cold sensation in her abdomen and abdominal pain. And so our diagnosis for her is kidney yang deficiency. And our goal with herbal and food therapy is to really warm her up and get her system flowing. So for food choices for her, we might choose warm cooked broths and stews to aid her digestion. And then we want warming pungent spices to kind of get her qi and blood flowing. A lot of these in Western medicine are known to be vasodilating and really stimulate blood flow as well. So here we have cinnamon and ginger, cloves, nutmeg, chives, and star anise. By the way, these are all great herbs to bring in the winter time if you're making a stew to kind of counteract this damp cold we have here in the Pacific Northwest. And for Judith, we might also bring in warming, young, tonifying foods. So in Chinese medicine, even the meats have kind of different temperatures that we use in different conditions. So lamb and bison are some of our warming meats. And then walnuts are also known to be warming and yang tonifying. Okay, so that concludes our talk on traditional Chinese medicine. I really appreciate you being here for this. This is a medical system that's very near and dear to my heart. And there's so much to talk about and, a very complex system to get into in an hour. So I'd love to hear any questions you have that came up throughout the talk, and we can go from there. Let's see, any questions coming up? Okay, well, if there's no questions immediately arising, I will go ahead and invite you to our next
question.
Oh, question?
All
right.
One question came up in the chat just now.
Question
about utilizing fresh herbs in addition or in lieu of the dried herbs.
Yeah, so that's a great question. So the complex answer is that fresh herbs actually have very different properties than dried herbs. So you use them in slightly different ways. So for instance, with ginger, generally ginger is one of our really strong warming herbs. But fresh ginger also does what we call releasing the exterior. So if you're just getting a cold and you want to help release that wind cold and kind of shoo it out from your system, fresh grated ginger with some lemon is the ideal. Versus if you're kind of have like a long-term yang deficiency and you really just need to heat up internally versus kind of releasing the exterior, you would use a dried form. So great question, somewhat complicated answer. From a Western medical perspective, the fresh herbs have these aromatic properties that are generally going to be a little more moving and stimulating. So they're always a good option. All right. Thank you, Dr. Rosalie, so much for your help. And thank you, everyone, for coming. So I want to invite you to our doc talk next week. It's March 8th, and it's going to be on optimizing the respiratory tree. So in the last few years, we've really seen the importance of having a healthy respiratory system. And in this doc talk, we're going to talk about breathing exercises and herbs and lifestyle and dietary strategies for supporting your upper respiratory tract and also supporting your lungs. And we're really excited to dive into that next week. And I also want to just invite you to reach out if any of these modalities are something that you want to follow up with, if you have a condition that you think might be that acupuncture or Chinese herbal medicine or anything in the system might be useful for, give us a call. Here's our number on the lower left-hand side. And you can also schedule online at prospernaturalhealth.com. And thank you again so much, and we look forward to working with you.